Okay, we're going to go through how to use our spinal orthotics. We have our cervical and thoracic dental rolls, and there's also a lumbar dental roll. These do come in different shapes and sizes, but don't worry, we'll make sure you're on the right one. We do use these normally to stabilize changes to the normal spinal curves. Recommendations: minimum effective dose is 15 minutes 5 times a week. However, optimal dose is 20 minutes a day, 7 days a week. Now we're going to run through how to get on and get off these. So first, with our cervical dental roll, there's 3 areas primarily we're going to focus on. So one's going to be lower down, 2 is going to be in the middle, and 3 is going to be in the upper section of the neck. Our first position is at the base of the neck. This is our lower position. Our second position is a couple of inches above that in our mid neck, and our final position is our upper section, which is just below the base of the skull. Depending on what is recommended for you, we are going to have the crest of the dental roll sitting on one of those points. Now it's very easy to use, getting on and off. It says shoulders on this side, so shoulders here, head resting over the top. Now it's very important that we have our head resting, because if we have any tension through the front of the neck, it's not going to allow for the changes to happen in the ligaments. Okay, so nice and relaxed when we're on these. On a firm surface, lay flat on your orthotic with straight legs. If you experience low back pain, you can bend your legs. To come up, roll to one side and remove the orthotic. We suggest rolling onto your back for an additional 1 minute, doing deep breathing. We're on these with our thoracic dental roll. Again, the crest is where we want to have the 3 points. Our first position is going to be our middle section. To find this, we find the point of the scapula and come straight across to the middle of the spine. This should be approximately T6. Our upper section is going to be 2 inches above this, and our lower section is going to be 2 inches below. On a firm surface, place the orthotic down behind you. Lay down and adjust your position to the target area. If you experience low back issues, bend your knees. When coming off the orthotic, roll to one side and remove the device. We suggest laying flat on your back for 1 extra minute before coming up. So we normally suggest starting off at 3 minutes and adding a minute each day up until the 15 to 20 minute mark. Now some people may experience some discomfort. Normally that happens around the 10-minute mark. At that time, I would suggest spending a few extra days on the 10 minutes before going up to 11, and so on all the way up to the 15 to 20 minute range. Now, if you have any queries on how to use it, please ask us when you come in for your next adjustment. We can make sure you're laying on it right, and we can answer any questions that you have.